Good morning, everyone, and welcome to today's lecture. Today, we are exploring Chapter 7, focusing on genetic diseases and inborn errors. Let's start by Part 1. We will be conducting a comprehensive analysis of the public health challenges these conditions present, the historical missteps we have made, and the incredible promise of modern genomic medicine. Let's start or let's begin by understanding the sheer scale and impact of this issue on our population. Congenital defects, a major burden. Congenital defects are not rare anomalies. They represent a major burden in public health. Approximately 3% of all newborn are born with a major abnormalities. When we extend the timeline to the first 5 years of life, that diagnostic rate jumps to 7.5% as developmental issues become more apparent. These defects are among the leading causes of infant mortality and long-term childhood disability. So, what exactly is causing these abnormalities? We generally categorize them into few primary areas. Abnormalities typically stem from four main sources. First, genetic factor, which are inherited errors in the DNA itself. Second, birth injuries, which involve physical trauma sustained during the delivery process. Third, maternal exposure to teratogens, infectious agents, or toxic substances encountered during pregnancy. And finally, number four, we must consider late life onset, where genetic predispositions combine with environmental factors over decades to cause adult chronic diseases. For the first part of this lecture, we are going to focus heavily on that third category, maternal exposure. We will diving into environmental teratogens. This encompasses the external agent, bacteria, viruses, drugs, and chemicals that can disrupt normal fetal development. Before we look at a specific example, we need to clarify our terminology. Teratogens versus carcinogens. You will often hear the terms teratogens and carcinogens discussed together, and for good reason. Teratogen is environmental agent that causes birth defects. Okay? While carcinogen is an agent that causes cancer. So this is the difference. The overlap occurs because many teratogens are mutagenic, meaning they alter the DNA. If a mutation happens in developing fetus, it causes birth defect. If it happens in adult tissue, It can trigger cancer. So I think it's clear now. Let's look at historical examples of infectious teratogens, starting with bacterial threats. Infectious agents like syphilis. Congenital syphilis was a massive public health crisis before the advent of penicillin. The syphilis bacteria can cross the placental barriers, causing devastating damage of the fetal nervous system, bones, and the skin. If or it frequently resulted in blindness and severe mental retardation. This is exactly why Wasserman blood tests was historically a mandatory requirement in some countries before couples could obtain a marriage license. It was an early public health screening measure. There is other viral infection instead of bacterial that I already discussed. Viral infections also pose a severe threat as seen with rubella. Rubella or German measles is normally a mild illness. However, if a mother is infected during a pregnancy, the virus attacks the developing fetus, most notably causing a profound congenital deafness. This is a massive public health victory because of routine widespread vaccination program. Congenital deafness caused by rubella has been virtually eliminated in vaccinated population. Beyond bacteria and viruses, we must also be wary of parasites like toxoplasmosis. Toxoplasmosis is parasitic infections. An adult might contract it and barely notice the symptoms, but it causes severe neurological damage to fetus. The primary reservoir for this parasite is cat, and transmission typically happens through handling infected by cat feces. This is why public health guidelines strictly advise pregnant women to avoid cleaning litter boxes and to wear gloves while gardening. Moving from infectious agents to chemical exposure, we must discuss one of the darkest environmental health disaster of the 20th century, the Minimata tragedy. In the 1950s in Minimata, Japan, a plastic factory continuously dumped mercury into the local bay. The mercury accumulated heavily in the local fish, which was the staple of the community's diet. The adults suffered neurological issue, but the most tragic impact was on the children. Because the fetus is highly sensitive to toxins, babies were born with profound brain damage and severe physical deformities, entirely preventable tragedy. as Dr. Marwan Jalambo, I visited this area and looked at it closely in the Minimata region of the Japan 20 years ago, where I was attending a half-year course titled Risk Assessment and Monitoring for Environmental Chemicals. Indeed, the Japanese government did an excellent job back then. They paid the fishermen more than their daily income to catch all contaminated fish in the area. After that, the fish were disposed of and they reclaimed the pollutant area by filling it and thereby expanding the land. Thalidomide epidemics. Chemical teratogens are not always industrial pollutants. Sometimes they come from the pharmacy. In the early 1960s, a drug called thalidomide was heavily marketed to pregnant women as safe, effective sedative for morning sickness. Tragically, it was a potent teratogen. It interrupted limbs developments, leading to thousands of babies being born with shortened, flipper like arms and legs. This primarily devastated Europe and Australia. You might wondering why the United States was largely spread from the thalidomide disaster. The answer is a story. The United States was protected almost entirely due to vigilance of one FDA official, Dr. Francis Kelsey. Despite intense pressure from the pharmaceutical manufacturer, Dr. Kelsey refused to approve thalidomide for the United States markets, demanding more safety data. Her scientific skepticism and dedication to public health saved thousands of American families from this tragedy. Thalidomide taught us a painful lesson about pharmaceutical and pregnancy. Risky prescription medications. Through painful experience, we have identified several other common drugs as severe teratogens. Tetracycline. Tetracycline, a common antibiotics, affect fetal bone and tooth development. Dilantin, anti-epilepsy drugs, causes physical and developmental effects. DES, diethyl stilbestrol, once given to prevent miscarriages, caused rare vaginal cancers in the daughters years later. And Accutane, highly effective acne medication, is strictly regulated because of its severe teratogenic effect. The standing public health advice, especially today, is that pregnant women should avoid all non essential medication. Legal recreational substances also pose massive risks. Let's talk about alcohol. It is surprising to many that alcohol was not formally recognized as teratogen until the 1970s. Today, we know there is absolutely no established safe level of alcohol consumption during pregnancy. Exposure can lead to fatal alcohol syndrome or FAS. This is the form of the fatal alcohol syndrome. Fatal alcohol syndrome is characterized by distinct facial deformities, stunted growth, and most critically, permanent, irreversible brain damage. Other common recreational and illicit substances also disrupt fetal development. Smoking tobacco restricts oxygen to the fetus, leading to premature birth, critically low birth weight, and drastically increased risk of sudden infant death syndrome. Illicit drugs like cocaine and heroin are just as dangerous. They cross the placenta, leading to fetus that is chemically addicted in the womb. These infants face agonizing withdrawal upon birth and face high risk of permanent neurological impairment. Now that we have covered environmental disruption, in the next lecture, in the part 2 of the same chapter, I will look at the error within the biological blueprint itself. Goodbye and see you later. Thank you.